Now coming to the next one. Okay. The next one is, in which of the phases of the bacterial growth curve the bacteria generally attains the maximum size? Yes, please tell me. What should be the answer of it? Is it the lag phase? Is it the log phase? Is it stationary? Is it death or decline phase? Which particular phase will be having the maximum size? So for that, you already have, I think, the understanding that the bacterial growth curve goes this way. The firstly, we have the lag phase, then we have the log phase, then we have the stationary phase, and then we have the decline phase. Okay, this is the story of bacterial growth curve, which you should know. This is the story of bacterial growth curve. So whenever a bacteria firstly being introduced into a culture media, so what it does, it adapts to those conditions, and that adaptation is which phase? Lag phase. So basically what is there? Adapt to the surroundings, and while adapting to the surroundings, that particular bacteria accumulate the nutrients. Okay, and that particular accumulation nutrients make it size big. So means there is an increase in size in which particular phase? That is in the lag phase. In the lag phase, there is an increase in the size. Is it fine? Then log phase comes, and in the log phase, there is an exponential increase in the numbers to the power n. Okay, there is an exponential increase in the numbers to the power n, and this is a phase which is like what you can say, which is the maximum active. The bacteria is maximum active in which particular phase? In the log phase, and this is a phase in which the ideal conditions are there for the gram staining. Okay, the ideal conditions are there for the gram staining in the log phase. After that comes the stationary phase, in which dead is equal to live. This particular one is the phase in which the dead bacteria, they are equal to the live ones. How we get to that? In this, what happens is that the bacteria, because of this rapid number increase, okay, so they have gone up rapidly metabolism. Okay, they have gone into that, and there is a start of what? Accumulation of the toxic metabolites. And because of that start of toxic metabolites, what happens? Some of them die. Okay, but some of them are alive. So that's why this, which phase comes? Stationary phase. And then comes the final death phase of them, that is termed as decline phase. जब उनके पाप का घड़ा भर जाता है तो कौन सा फेज आता है? डिक्लाइन फेज. ओके, सो ये भी याद रखना है कि डिक्लाइन फेज में देयर इज अ कंप्लीट एक्यूमुलेशन ऑफ टॉक्सिक मेटाबोलाइट्स, और उसके पास कोई चारा नहीं रहता, उसको अपने गुनाहों की वजह की सजा मिलती है और उसे मरना पड़ता है. ठीक है, सो दैट यू नीड टू नो. सो देखो, हर किसी का क्या वो है, मरना कोई नहीं चाहता. तो बैक्टीरिया को भी दिख जाता है स्टेशनरी फेज में कि आगे मेरी मौत है. ओके, तो स्टेशनरी फेज में ही वो अपना अटेम्प्ट करता है क्या बनाने का? स्पोर. और यही क्वेश्चन आता है कि स्पोरुलेशन कौन से फेज में होता है? स्पोरुलेशन होता है दोस्तों स्टेशनरी फेज में. स्पोरुलेशन कौन से फेज में होता है? स्टेशनरी फेज में. और देयर इज अ कंप्लीट एक्यूमुलेशन कहाँ पे होती है? डिक्लाइन फेज में. मैक्सिमम नंबर्स कहाँ पे होते हैं? मैक्सिमम नंबर्स होते हैं लॉग फेज में. इंपॉर्टेंट यहाँ पे क्या है? इंपॉर्टेंट ये है कि जो ग्रोथ रेट है वो कांस्टेंट होता है. यहाँ पे तुम्हें फंसा लेगा एग्जामिनर कि ग्रोथ नंबर ऑफ बैक्टीरिया तो बढ़े टू द पावर एन, लेकिन उसका ग्रोथ रेट क्या है? कांस्टेंट. क्या? टू द पावर एन. तो यहाँ पे इंपॉर्टेंट पॉइंट क्या है? नंबर तो ठीक है बॉस, एवरीबडी विल टेल यू, हर कोई बताएगा तुम्हें, लेकिन कोई ये नहीं बताएगा कि ग्रोथ रेट कांस्टेंट है. फाइन. और लैग फेज में क्या होगा? लैग फेज वो फेज है जिसमें वो अडेप्ट करेगा कंडीशन को स्टार्टिंग में, और बैठे बैठे खाएगा, और बैठे बैठे खाने पे क्या होगा? साइज इंक्रीज. सो दिस इज व्हाट इज द बैक्टीरियल ग्रोथ कर्व, एंड ऑब्वियसली द आंसर ऑफ आवर्स इज व्हाट? लैग फेज. इज इट फाइन? आई सपोज दिस इज क्लियर नाउ. Now coming to this particular one, the electron microscopic picture of an organism is given below. What is the correct statement regarding the organism? So guys, these are the EM images, EM is electron microscopy images of rabies virus. And as you know, the rabies virus is bullet shape. Okay, this is bullet shape, and the speed of this bullet is also being defined as 3 mm per hour. Okay, the speed of this bullet is how much? 3 mm per hour. And in this, the first one is the speed of the virus is 20 mm per hour. Just now we have heard of it is 3 mm per hour. So this statement is wrong. The demonstration of Negri bodies is anti-mortem diagnosis. Another statement which is wrong, because Negri bodies demonstration is post-mortem diagnosis. The subfamily of virus is lentivirni. No, lentivirni subfamily of HIV. Here it is Lisa. Okay, here it is what? Lisa virni. Rabies kisko hui? Lisa ko. Okay, don't take it to the heart, just for the remembrance sake. Fine. So subfamily of virus is what? Lentivirni. This statement is also wrong. Then we have this, the direct fluorescent antibody test. Means you have preformed antibody with you of rabies. That is being done for what, guys? That is being done for antigen detection. And from which particular samples? Nape of neck hair follicle and the corneal smear. In them, you try to demonstrate a what, guys? Antigen. Fine. So this is what is the correct statement D regarding this rabies virus. Other important aspect which I can tell you, which is like frequently asked up in the previous papers, that 80% of the patient of rabies, they present with furious rabies. And that particular furious rabies, like the patient is having irritation, the patient is having those particular things like hydrophobia and restlessness, all sorts of like maximum stimulation happens up. But 20% cases presents with paralytic one. Okay, in this furious component, 20% presents with what? Paralytic rabies. And in that, there is hardly any excitation and all. In them, they present with fasciculations, edema. That particular sort of thing happens in that particular aspect. Remember this. Other than that, what is important is which particular, like, what do you say, which particular areas in India, they don't have rabies. The answer is Lakshadweep and Andaman Nicobar, because they are water isolated ones, and there the rabies is not there. Okay. Other questions which can be asked here is, I've already told up that the postmortem diagnosis based on Negri body demonstration by the Sellers technique. And what we do in that, from the hippocampal area, we take the brain biopsy tissue and we stain it with basic fissions, or other options also there to stain it up. And that is what is termed as Sellers technique, and you can demonstrate the Negri bodies in that. Fine. That is pathognomic of rabies. Other than that, you can inoculate it to the animals. Animal will also develop what? Rabies. So all sorts of things are there. And nowadays we have PCR also, by which you can make the diagnosis of it. So there was a question in which the option was regarding the corneal smear. And if the corneal smear is taken up, then it is said to be going for the PCR, reverse transcriptase PCR. Why? Because like the yield of the corneal smear, the viral yield is very less. So that's why you need to amplify that small amount. And that amplification is being done with what? That amplification is done with the PCR. That is the reverse transcriptase PCR. Why reverse transcriptase PCR? Because this is a RNA virus. Okay, it's a RNA virus. Yes, can you tell me, is it single stranded or double stranded? It's single stranded RNA virus. And is it enveloped or non-enveloped? This particular one is, yes, non-enveloped. Okay, this particular one is non-enveloped, and it is a negative sense RNA virus. It is a negative sense RNA virus, and this negative sense RNA virus firstly change into positive sense with the help of RNA polymerase enzyme, and then it replicates. Okay, so that's the logic of this particular rabies virus, and the speed we already have mentioned of, that is 3 mm per hour. Coming to this, a 22-year-old male is brought to the hospital due to fever, frontal headache, photophobia, nausea, anorexia. The physical examination shows positive Brudzinski sign. The lumbar puncture was done. CSF analysis shows increased opening pressure, normal protein and glucose. See, this statement is important. Leukocyte count is 200. What is the most likely organism implicated in causing the above condition? So one thing is for sure, that this is a sufficient hint to be like knowing up that we are talking about certain things which are virus or fungal. Okay, not the bacteria, because if bacteria is there, the glucose would have been like absent or very low, because they are like, they love glucose, so they end up that. Okay, so that you also need to know. So obviously this is not there, this is not there, this is what is the answer, the antiretroviruses, and this is not there. So antiretroviruses, they are said to be associated with the meningitis, and these particular ones, antiretroviruses, are one of the common causes of this particular meningitis, like aseptic meningitis also you can say, a sort of. And in them, obviously it's a meningitis, so increased opening pressure will be there, these particular things will be normal, and leukocyte count can be around 200 in the case of them. And the answer here is what? Antiretroviruses. Now this you already know that if it would have been a pyogenic meningitis, pyogenic means by the bacterial one, so obviously there will be a very massive increase in the neutrophil counts in the CSF. Okay, the proteins in the CSF, they also would have increased, the CSF proteins. Okay, and the CSF glucose would have been very low, very low, and even sometimes zero it can also happen. So CSF protein is very much increased, CSF glucose is decreased. Along with that, there is a massive increase in neutrophil count for the pyogenic meningitis, that is the bacterial meningitis. Okay, whereas in the fungal and viral, the same thing which is there in the question can happen of, that there is a slight increase in leukocyte count. Other than that, there is increased opening pressure, and normal protein glucose is a feature of them. And in the case of TBM, that is TB meningitis, what sort of thing happens? There is an increase in the lymphocytes. Okay, there is an increase in the lymphocytes. The sugar will decrease in the CSF sugar, and in this particular case, there is an increase in the CSF proteins. Okay, so CSF proteins can increase in everything actually. Okay, even in the viral and fungal also it can increase of. So this is the way to approach of these types of questions. You should know that what happens where, and then only you will able to answer up regarding the correct option. Is it fine? And this question will be coming off. And what they can do, guys, I already have a video on my YouTube channel also, and in the LN also, that how to approach up organism wise. So they can give you slight hints regarding that, that it is a gram positive cocci or a gram negative cocci, like that they can ask of in the question. Then they can give you a hint regarding this, that it grows in chocolate agar, it shows satellitism. Okay, so all these things they will link off. Either other way around also they can do what? They can put up that yes, we are talking about a HIV positive one, and the most common cause of meningitis in HIV is cryptococcal meningitis. So they can say that we are dealing with a true yeast here. Okay, which culture media? SDA, along with a nigger seed agar, bird seed agar, that can be used for this particular one. So these are the important hints which you should know, that which staining you will do, Indian ink staining, why you are doing it, for knowing the capsule and all. Regarding the viruses, we just have heard of that these type of things, they will be given in the question. They will ask which virus causes it. Antivirus is one of the common causes of causing meningitis. That also you should know. So all these are the important ones which you should know, like which is catalase positive, oxidase positive, which ferments glucose and maltose both, like that. This is the way to approach of these types of questions, and definitely in the exam, this sort of thing you will find for sure. Okay. A 40-year-old male from the village presented with the complaints of fever and chills to the hospital. He also informed up that he has noticed dark stool recently. Means the blood is coming in the stool. The physician performed a test, the image of which is shown below. The image shows an area just near the anterior cubital fossa where these changes are noticed, which is the most likely infection we are talking about. So guys, this is what you call as the picture of tourniquet test, and more than 10 petechial lesions per square inch is there in the criteria of DHF. Along with that, the platelet count less than 1 lakh, and these are the danger signs when the blood starts coming in the stool, or somebody develops some mucosal bleeds, like any sort of bleed. It can be vaginal bleed, it can be like this type, that is it coming in the stool and all. So these all are hematuria can happen of. So these all are what? Danger signs, warning signs of dengue. So we are talking about what, guys? We are talking about dengue here. And this particular test is what? This is tourniquet test, which is being done for the diagnosis of dengue and dengue hemorrhagic fever. Obviously, more than 10 petechial lesions per square inch is diagnostic of this, and that is what is termed as tourniquet test. Fine. Now, important is the recent question which have come regarding the dengue, which can come to you also. And in that, what is there? That which particular investigations you will be doing up to, what do you say, initial 3 days of fever of the dengue, which all investigations can you do? So this everybody knows that you can go for NS1 antigen testing, okay? NS1 antigen testing by the card method, one of them. Okay, you already know what is NS, that is non-specific antigen, NS1 antigen. Along with that, nowadays they say that ELISA is better than this, that is card test. So obviously NS1 antigen testing by this ELISA is way better than the card method. Okay, and initial 2 days we have only this test at our disposal. Besides that, we have the other one, that is you can go for PCR. PCR for what? Den. You could able to know the serotypes also. That is Den 1, Den 2, Den 3, Den 4. So 4 serotypes are there. The most dangerous is second, and 1 followed by 2, that antibody dependent enhancement. Previous question of your FMG, that is ADE. This phenomena, that is termed as antibody dependent enhancement. This also is observed in dengue. Okay, so this is also to be remembered. Along with that, what else you need to know here is that in that option of that question, what they have given off, they have given off for the cell line culture of dengue virus. Okay, and they have written off IgM, okay, IgM dengue antibodies testing. Okay, basically IgM capture ELISA you do, and you go for IgM dengue antibodies. These 4 options were there, and the question is, in the first 3 days of fever, which particular investigations you will be doing up except? That was the question. It can definitely come again, and answer to that is what, guys? This can be done. Yes, this is regularly done nowadays. Cell line culture is not done regularly, but it can be done up to 3 days of fever. But this surely can't be done up to 3 days of fever. Why? In the dengue? Because this comes on the 5th day. So this particular antibody comes on 5th day of the fever. So you can't diagnose it up to the 3 days and all. So that's what the answer is. This is the IgM dengue antibodies. This can't be done by this particular method of diagnosis for the dengue. So this question most likely will be coming up in your exam for sure. Okay. And this you already know that which particular mosquito spreads off. That is Aedes, that is tiger mosquito, daytime biting it does. So all those particular ones, they are there. And this is another previous question of yours, that is antibody dependent enhancement. And the likely question which I think can come in your exam is this, that they can ask you that what are the warning signs when you should go for the hospitalization. So that these are the warning signs. You can remember them by this ABC LPH. And what is there in that? A is, guys, abdominal pain. If there is a sudden abdominal pain, that is like a sort of a warning sign for the dengue. Okay. Bleeding, just I've told you, that's what happening in this question also. That particular person was having the blood in the stool. Okay. So that is the GI bleeding is happening off. Mucosal bleeding, that is there. And it can be from various sites, like it can be a hematuria, it can be a vaginal bleeding also. All sorts of other ones, they are also the warning signs for the dengue. Then the C is clinical fluid accumulation. Okay. So there is the fluid accumulation starts. Then lethargy, certainly that feels very lethargic and all, the patient, that is also a warning sign. P, persistent vomiting is happening to the patient, that is also an important warning sign to be determined. H is hepatomegaly more than 2 centimeters. If you are observing up, another warning sign of it. So remember them by this ABC LPH. And this question definitely will come in the exam, that what are the warning signs of dengue, and they are favorites of examiner. Definitely 1 or 2 questions regarding dengue you will be getting up in the exam. And can you tell me the family of it? So that is Flaviviridae, okay, and that's the arboviral family, Flaviviridae. Is it fine? Now coming to the next one. All are false statement about the exotoxin except for, okay, all are false statement about exotoxin except for. See this, all are false about exotoxin except for means all the statements are false regarding except one. So it is LPS in nature, this is false. Produced by gram-negative bacteria, this is also false. Is it heat stable? Like, what do you say? False. Toxoid can be prepared. This is what is true is. Okay, so this is what the true statement about exotoxin. The toxoid can be prepared up from the exotoxin and it is not heat stable. Okay, it is not heat stable. It is produced by gram-positive bacteria mostly, and this is not having LPS in the nature. Okay, so these are the important ones. The question was asked in a twisted fashion. So you should know that LPS, we are talking about what? Endotoxin. And this endotoxin is being produced by mostly gram-negative bacteria. But some of the gram-negative bacteria, like this question was there in the last FMG of yours. Yes, can you tell me which E. coli was there, which endo and exo both? O157H7. Okay, O157H7, this particular one is there, which does HUS, also termed as Shiga-like toxin, which is also termed as what? Shiga-like toxin. This particular one, Shiga-like toxin, and having this disease, they are being causing what? HUS. Along with that, the third name also they can ask you, that is virotoxigenic E. coli is the other name of it, because it produces virotoxins, which are also termed as Shiga-like toxin, and it leads to this HUS, that is hemolytic uremic syndrome in the children. Okay, so this is the organism which I am telling up produces this particular SLT as what? Exotoxin. Okay, exotoxin. So this is the SLT which is an exotoxin, and mainly gram-negative produces what? Endotoxin. And the same exotoxin, if we talk about, it can be by the Shigella and it can be by the Pseudomonas. It can be by the Pseudomonas. Okay, so these are the important points which you need to know. Now coming to the next one, the false about the epidermophyton, and I suppose this is easy. We have already have a mnemonic for this, so you must be knowing this. It involves hair and nails. Microconidia, they are absent. Macroconidia, they are pencil shape. It causes superficial infection. Okay, so this is true that it causes superficial infection, no doubt, because superficial mycosis it is. Macroconidia are pencil shape, definitely not. Macroconidia pencil shape are what? Trichophyton. So this is what is false is. Microconidia are absent. Yes, they are absent. It involves what? Hair and nails. Yes, it does involve what? Hair and nails. Okay. So let's see now this question, the false about epidermophyton. And in the epidermophyton, the first statement involves skin and nails. Very correct. The microconidia are absent. Correct. The macroconidia are pencil shape. This statement is wrong. It causes superficial infection. This is superficial mycosis. Obviously, it does what? Superficial infection. Is it fine? And we already have the table for this. That is Tame. And in this, we already know tricho. T is what? Trichophyton. And the trichophyton involves what, guys? Skin, hair, and nails. Skin, hair, and nails. The M is microsporum. And in the microsporum, we have skin and hair. Okay. And in the epidermophyton, we have skin and nails. Yes or no? Skin and nails. So this is very clear that the trichophyton is skin, hair, and nails. Microsporum M do not involve N. Remember like this. So skin and hairs. Epidermophyton, skin and nails. Epidermophyton is what? Skin and nails. So like that, this to be remembered. Another one is regarding the macroconidia and microconidia. Okay, macroconidia means what, guys? बताएं. Macroconidia means what? So macroconidia means the big spore, microconidia means small spore. So there is TME. So trichophyton, what about the macroconidia? It looks like cylindrical. Okay, this particular one looks like what? Cylindrical. Then M is what? M is microsporum. Okay, M is microsporum, the name is microsporum. And how does the macroconidia look like of it? It is spindle shape. This particular one is spindle shape. E is epidermophyton. It is club or boat shape. It is club or boat shape. This also needs to be remembered. About the small spore, that is microconidia, the trichophyton is having what? Numerous microconidias. The microsporum is having what? Less. And epidermophyton, this particular one is having absent microconidia, which is a feature of this particular one. Okay. So this also I have made you to remember like that. Tri is tricycle. And what is there in the cycle wheels? There are spokes. Okay. So remember, these spokes are made up of what? Pencil. So this is pencil shape. Remember that. M is spindle shape, microsporum, SP, spindle. Epidermophyton. You have to imagine what? That over a club, a boat is there. Okay. The imagination is important. And the small children, they are not allowed to go into that club, which is having a boat over it. Fine. So these upside associations, they does come in your mind in the exam. So you need to make them. बनानी पड़ती हैं याद रखने के लिए. Okay. So remember that particular stuff.